I'm acutely aware that I have 15 minutes, and I'm really poor at keeping track of time, but there is a timer on here. This morning has been fascinating, as is this afternoon. I was struck by our first two presenters, Kirsten being one, of how some of the items that you were talking about, and I wondered how they related to young people. Because some of the items that you were talking about in your questionnaire resonate very much with how we think about some of the negative experiences of young people and the impact that that might have on future sexual well-being and sexual health. So I thought there were some kind of interesting things there that I wanted to come back to, and I haven't got time to now. So, like Pierre, I'm talking about a study that has only just started, right? So it's called iMINDS. That's a backdrop to Edinburgh, because it's like the university has to advertise itself. The context to all of this is online child sexual abuse and exploitation, which is an area that I think I've been grinding on with for quite some considerable time. And the context being that we have probably converging evidence that online child sexual exploitation and abuse, while it does not overtake the abuse that we see in terms of contact offences and abuse that takes place in family homes, certainly is on the rise. So what we have is evidence from different sources, including the number of offences committed. So if we look at police data, the number of perpetrators, if we look at surveys of young people in terms of victimization, but we also have other data that somehow examines some of the products of this abuse. For example, child sexual abuse images, textual material, and increasingly self-produced images, so content, and this is a very emotive term, sexual content that is being created by young people themselves. So we've got evidence here that seems to suggest this problem is on the rise. It's certainly not going away. And there are a whole lot of definitional complexities in terms of how we define this. So Nancy had to kind of justify high masturbation, low masturbation. Well, when we start to look at how we conceptualize these crimes, increasingly we're talking about crimes that have some element of technology mediation in it at any point in the crime. So some of our old categorization systems that I'll touch upon actually are struggling now. So I've just been finishing looking at some data that's not related to this, and we had technology playing a part, for example, in terms of transactional sexual exploitation of children, where money is being exchanged for sexual services. And the technology there was in terms of accessing children to make occasions for the sexual activity to actually take place. There was no other technology involved. And then right the way through to the other end of the spectrum is, for example, live streaming of sexual abuse, where people can ask for sex on demand by a child who is at maybe a remote or not so very remote location, given the number of cases that are being reported, for example, in the UK. So we have almost a continuum of how technology may play a part. And if we broaden this definition, not only does it cause problems for us, but it also, I think, highlights the fact that increasingly, as technology comes to dominate most of our activities, how do we separate out these online and offline spaces? And that becomes an issue in terms of our online interventions as well. So lots of challenges with these definitions. The broad definitions capture more types of abusive practices, and the narrow definitions are maybe problematic in that we, if you like, ignore or fail to recognize the abusive elements in a lot of these activities that have impacts on children. We also know that there is, kind of boundaries. So when I was listening to a lot of what Kirsten was saying, I thought this is really interesting, because when we start to think about adolescence, some of the boundaries around what we see as being acceptable or unacceptable, sexual pleasure in children is something of a taboo subject for us that we feel terribly uncomfortable with. So what constitutes appropriate behavior? And very often, just as we were talking earlier, that some of the things that we use to determine whether something is acceptable or not are driven largely by maybe Western, white, male populations. So we have tensions here in terms of sexuality and children, and also their rights to be protected. So there are real difficulties here. And there appear to be generational gaps between young people, parents, teachers, law enforcement, in relation to risk-taking and what's acceptable in terms of risk-taking, and managing feelings when things go wrong of fear and shame, and victim blaming. And victim blaming stands out in this area. And in the middle of all of this, we have rapid technological change. I remind us we've all got smartphones in our pockets or in our hands or wherever. Smartphones didn't exist until not that long ago. I think 2003 was when we saw easy access to camera-enabled phones, mobile devices. So in a very short space of time, there's been quite rapid technological change. We are benefiting from some of those, so kind of platforms such as, it used to be such as things like Skype, but increasingly Teams, Zoom. These are the platforms that initially we used to communicate with people where we hadn't got any other opportunity to communicate because of distance. But these are the very platforms that are also being used now in what we might think of as being exploitative or abusive behavior by the very people that Per was talking about, who seem to have a sexual interest in children. So technology is integrated into our lives. Our attempts to separate kind of online and offline spaces becoming quite compromised. And we need to think about this a little bit more in terms of both our definitions and the way that we conceptualize what young people are having to actually manage. Okay, so this is an old typology of these offences, and we had three silos. We had our contact offences that we largely thought of as being taking place in some offline space, and we had these child image-related offences, and we had online grooming. And then all of a sudden, online grooming was related to contact offences in terms of production of images, as was these image-related offences, because they had to be produced by somebody else. And then we have this whole great mess around our abilities to self-produce content. Earlier, there was some conversation around pornography and how pornography is changing. Well, self-produced pornography now operates quite a large space in this market. But self-produced images of children by children, sexual images, in most jurisdictions constitute child pornography, child sexual abuse images. My argument there being that the making of this content is not in itself problematic in most instances, but the way it's used by others definitely is. And then we've got this live streaming of sexual abuse, and we've got trafficking and transactional sexual abuse that takes place in this space. What we know about the few victim and survivor studies, and I promise you I'm rapidly going to get to the intervention, what we know about victim and survivor studies would suggest that the majority of people who have been kind of exposed to online child sexual abuse, exploitation, largely their experiences are dominated by self-blame, self-criticism, particularly about being enmeshed and controlled within relationships. You see pathologies, psychopathologies such as depression, self-harm, anxiety, PTSD-related symptoms, perceived identity changes, issues with trust. And when we think about well-being, particularly within a sexual domain, trust becomes absolutely important. Because if your experience of your online relationships is uncertainty and ambivalence about who you can trust, and where you thought you trusted somebody only to be abused and exploited, then the challenges that poses for future relationships are quite considerable. But more than anything, these experiences for many, many young people are dominated by guilt and shame. And if you think about the very products of this, in terms of largely image-related products, so products of maybe taken by children or of sexual abuse or exploitative practices. Never before has this been the case. We relied on people's disclosures. We didn't have pictures of what had actually happened by them, with them, to them. And all of a sudden, I don't know about you, but the shame and the humiliation, which we're now seeing in other image-related offences against adults, is quite acute when you know that not only has something taken place in private that then becomes public, but it's open to the gaze of others. So if I was sexually abused as a child, knowing that somebody else, whether it's law enforcement, child protection agencies, other people online are looking at my pictures of being abused, I can't think of anything that's going to make me feel more ashamed and uncomfortable. So this area is got way to go. We've not done a very good job. Peer was, I think, understandably quite critical of the interventions that we've developed for people and experiencing an interest, minors with an interest in children, or minor-attracted children. The terminology is changing. Anyway, but at least there has been an interest there, Per. And there are provisions for people, and you're right, they lack a strong evidence base. They probably, in terms of user experience, seem reasonably okay and acceptable, but there is not strong evidence base in terms of what works. With young people, well, you know, we've invested heavily. The UK was the first, I think, to develop, which has never been used, hardly, after the first few years, because it was too expensive to run, a program for image-related offenders. But with children, there is no evidence-based interventions at all. And the interventions that are being used are largely trauma-focused interventions, which may be perfectly relevant, but may not necessarily be, which maybe do not actually grasp or understand the nature of some of the experiences, and these challenges by both young people as well as adults about the perceived agency that young people played in these offences. And this comes back to my comment in relation to Kirsten's presentation this morning. I think it's interesting that we struggle with this notion of agency. We use it against young people when things go wrong. It was your own fault. Why did you do that? You were talking to strangers online. You know, you were exposing yourself kind of when you were supposedly in bed. And then we talk about not having agency because we then strip away their kind of sexuality and talk about them as children. You know, these are passive recipients of things that happen to them. But if you look at any of the textual material that actually indicates engagement of young people in terms of online grooming, you will see that whether it's through persuasion, coercion, cajoling, or whether it's simply a need to think that somebody loves me, children engage at different levels and in different ways. So we've got some really kind of odd, ambivalent attitudes. So we've got a lot of things that we need to do. Some are very practical. Young people want content taken down, but there are more complex things that we need. Now, iMINDS has only just started. It's a UK-based study, but because it's funded by the National Institute for Health-Related Research, but what we are hoping is that this is no more than a feasibility study at this stage, and that was partly determined by our funders. They felt it was too adventurous to try and do anything more in the time period that we had available. But it's an intervention, a digital intervention, so it's another online intervention again, to improve mental health, I think I'd put brackets around, but interpersonal resilience for young people who've experienced online sexual abuse. The people in the research come from the University of Manchester and the University of Edinburgh, but also from the complex trauma unit in Manchester. So at the minute it's UK focused because of the funders, but we're hoping that we expand outside of that. So the problem, why are we doing this research? We know that online experiences are on the rise. We know that young people, for example, can be coerced into sharing sexual material of themselves or take part in sexual activities or have sexual conversations by text. No evidence-based, accessible interventions to support young people who've been exposed. Our trap is because of who we are funded by, means that we have to work within our National Health Service, and because of ethical concerns about interventions with this young population, in fact, we are only using people who are currently in child and adolescent mental health services, in part because there is then a network of support around them. So the aims, right, is to work with young people, parents, caregivers, relevant agencies to develop an intervention. We want to create an intervention that young people find easy to use, that they can choose when they're going to use it. So if it's 11 o'clock at night or 4 o'clock in the morning, they can still use it. It has a positive effect on mental health and well-being. It helps them to stay safe on the internet. So we've got some tangential goals there. It could be used in the context of NHS services. Otherwise, why is NHS supporting this? So again, I'm going to be really quickly going to go through these slides. So primary aim to actually evaluate the feasibility, acceptability, and usability of a secure, interactive, theoretically informed, multimedia, digital intervention with the goals of reducing risk of victimization and harm and improving mental health and well-being. And it's co-designed with users. So we're working with young people. Our primary drive is to involve young people, especially young people with lived experience of abuse, in the design of this. And the focus behind it very much is the individual, and the underlying research to this is an existing piece of work that we've already been involved in relation to mentalization. And one of the big challenges for us in working with these young people is that they do not share a similar view of ourselves in terms of what is necessarily happening with their experiences and online. So their inability to actually maybe take a step back to try and understand the motives of people with a sexual interest in children and why they should be engaging with them online, and to understand their own levels of emotional and sexual arousal that takes place in terms of these interactions seems central. We know that poor mentalization skills is associated with a lot of other mental health difficulties, particularly affect regulation. And affect regulation, as Per will know, is one of the most challenging things in terms of any intervention where sexual arousal plays a key part. So this is the underlying kind of context for us, but the context is also this online environment. The online environment strips away some of the cues that we might otherwise have there to try and understand why somebody is engaging with me. And it impacts on our ability to make decisions about risk and who we can trust. So these are really quite central. And why a digital intervention? Well, for the same reason that priority is a digital intervention. It increases how many people can actually access this. It can be scaled up. It ensures for us that support could be in place but where the intervention could take place as part of this everyday flow. It's not something that's only taking place within a therapeutic environment on a specific occasion, on once a week or twice a week or whatever it is. And it gives immediate access. And we thought we could achieve clinical benefit using relatively fewer resources. CAMS services are expensive to run. In the UK, we have long waiting lists. And since COVID, we have even longer waiting lists. So very briefly, and again, other people have said, I've got no time to talk about this, and I haven't. I've run over my time. It's a non-randomized feasibility trial. It's using a mixed methods design. It's got two main work streams. One starts with qualitative data with healthcare professionals, co-production of the development of the digital platform. That's already started. Work stream 2 is the intervention itself. It's fairly short, small sample, only 60 young people across 2 sites. And we're looking to identify key barriers and facilitators and unintended consequences of using iMINDS into existing care pathways. So you can't see that. I'm sure it's too tiny. That's just really talking us through the actual stages of the trial. We've got fairly heavy patient and public involvement. So we have our lived experience advisory group, we have parents and carers in an advisory group, and we have a national stakeholder advisory committee that includes some of our big tech companies. Because if they can't provide, if we can show evidence that if this intervention works, then there is a possibility, as there is with priority, that could also be one place to provide a platform to signpost access. And that's it.